Hello, I'm Dr. Maury Markman from the University of Texas MD Anderson Cancer Center, and I wanted to briefly discuss a very interesting analysis that was recently published in the December 10th issue of the Journal of Clinical Oncology, which was a meta-analysis involving 13 trials that had previously been published regarding the question of the value of chemoradiation given as a primary treatment of women with locally advanced cervix cancer. As probably many of you know, previous studies had demonstrated the utility of this approach, and in fact in 1999 the National Cancer Institute issued a clinical alert providing this information to patients, families, and the public. However, since that time there has been some concern regarding the ultimate impact of this approach, and not everyone was fully comfortable with how to interpret the data. So this meta-analysis was both important and timely. And as I said, this involved 13 trials. And the bottom line here is that at 5 years, there was a 6% improvement in overall survival associated with the use of chemoradiotherapy versus radiation therapy alone in the populations that had been entered in the trials. Clearly, at 5 years, this is a very substantial improvement in overall survival, very much demonstrating the clinical utility, the major clinical utility associated with the combination of chemotherapy and radiation given concurrently in this setting. It is also important to note that there are other questions that were brought up by some of the data in these trials, including the question of perhaps continuing chemotherapy after the completion of the radiation therapy may further enhance the benefits of this treatment strategy. At this point, this is just a hypothesis, but further studies are indicated to see if there are strategies that may be implemented in addition to the chemoradiation therapy that may improve the outcome of women with locally advanced cervix cancer. I would encourage you to read this very interesting paper that appeared in the December 10th issue of the Journal of Clinical Oncology, volume 26, page 5802. Thank you for your attention.